Good afternoon, class. I recorded this lecture on the 23rd of February, last Tuesday, right? Today is the 12th day of Lunar New Year. So for those who are celebrating Lunar New Year, Happy New Year, right? Congratulations, you have just completed your CA3, you have completed all your CAs. So now you're just waiting for the final exam, right? And also this is going to be a series of six final lectures on the last region of the body that you're going to learn in year one. So that will be head and neck, right? So we divided the head and neck into 6 weeks, right? So week 1, this week, you're going to actually cover the neck, right? Define the neck, then the structures in the neck, right? Important structures, relations, blood supply, as well as a nerve, yeah? Right, next week we're going to cover the face and the scalp, right? Following that, we're going to actually open up the cranial cavity and to study the contents of the cranial cavity, right? On week 4, you're going to actually start explore the orbit, contents, as well as the nasal cavities, right? And following that, you're going to actually look at the oral cavity and the structures behind that will be the pharynx. And the final week of the head and neck will be on the ear as well as the larynx. So this will actually extend from 1st March to the 6th of April. So slightly more than a month, right? So with that, you conclude the whole of the study of the anatomy. And I hope you will enjoy this final 6 weeks of anatomy. And then by then, we should actually prepare you sufficiently for your clinical years as well as your clinical practice, right? Enjoy and happy learning. Thank you. Okay, good. First, we'll start with the neck, right? First, of course, you have to know where is the neck. Basically, neck is an extension of the trunk above the thorax and below the head, right? So we're going to define actually the boundaries of the neck and know the important structures and how they are arranged, their relations, and of course, the neurovascular bundles, right? Okay, let's move on. So like I said, the neck basically is an extension of the trunk above the thorax. So basically, the boundaries between the neck and the thorax basically is bounded by this thing here known as the thoracic inlet. Okay, some textbook will call this the superior thoracic aperture. So basically, it's bounded posteriorly by the first thoracic vertebra, and of course the first rib, and its costal cartilage, and of course the manubrium sternum, right? So that will be the thoracic inlet. And superiorly is bounded by, right now we are looking from the front, yeah? Bounded by inferior border of the mandible. Later on, I'll show you the sort of posterior part of the superior boundary, right? Okay, when we remove the clavicle, this will be the enlarged view of the thoracic inlet. Okay, remember thoracic inlet, that is where the communications between structures, yeah, of the thorax to the neck and vice versa, right? Okay, so that is thoracic inlet. Right, I'm going to introduce to you another term. Right now we are looking from the side view as well as oblique view, yeah? There's another term known as thoracic outlet. Thoracic outlet basically is a space, yeah, between the clavicle and the first rib. So if we were to look at this diagram, this is the clavicle, right? And below that, that will be the first rib. So this space here, between the first rib and the clavicle, that's what we call it thoracic outlet. That's what the structures between the thorax, neck, travels to the upper limb and vice versa, right? So sometimes actually you have compressions of the structures within the outlet. We call it the thoracic outlet syndrome, right? Okay, especially the brachial plexus as well as subclavian artery and veins, right? So if we are looking from the side view, this is the thoracic outlet, yeah? It's a space between the first rib and the clavicle, all right? Okay. So again, looking at the side view, so the upper boundary of the the neck will be the lower border of the mandible. So there are some terminologies, a lot of new terminologies and a lot of new names that we're going to actually sort of introduce to you, yeah? So this is of course the angle of the mandible. Behind that, that will part of the skull, right? That will be we call it the mastoid process. You can actually sort of palpate yourself behind the ear. And of course, yeah, so later on, we're going to rotate the skull and then let you show you the upper boundary of the neck, okay? So remember, the lower boundary will be the thoracic inlet, upper boundary will be the mandible mastoid process for the time being. If we were to rotate the body, right, looking at the back, okay? So if we were to actually sort of use your fingers and then palpate at the back of your skull, right? The most prominent part here is known as external occipital protuberance. Right? Okay, this bone here is known as occipital bone. Of course, the most prominent part, we call it external occipital protuberance, right? And then diverging out from this protuberance, there are some elevations on the bone, right? This is known as superior knuckle line. And of course, there's an inferior also, right? So superior knuckle line basically is the sort of attachments of muscles of the back of the neck, right? So basically that will actually form the upper boundary of the neck, right? So upper boundary is by lower border of mandible, angle of mandible, mastoid process, external occipital protuberance, and the superior knuckle line, right? So that is what we're going to study for this week, right? Anything that is between the thoracic inlet and the upper boundary of the neck. Okay, good. Okay, for the neck, there are some landmarks that you have to be familiar with, right? So of course, this is a side view of the skeletal structures. Okay, we'll come to this later, right? So I want you to actually make some experiment, yeah? Use your thumb and the index finger, right? Locate the lower border of mandible. And I want you to run your fingers just below the lower border of mandible and then palpate for this bone here, right? This bone is known as the hyoid bone. Basically, this is a hanging bone because it's actually hung there actually by some attachments of the muscles. Yeah, some muscles above we call it suprahyoid muscles, and some of muscles attached inferiorly we call it infrahyoid muscles, right? And right after palpating the hyoid bone, I want you to continue to run down the fingers until you actually palpate another hard structures known as the thyroid cartilage. Yeah, that is one of the cartilage of the larynx, right? Okay, it is a big cartilage, right? And in front of this thyroid cartilage, this is what we call it the Adam's apple in the male, right? And then continue to run down your fingers until you hit another cartilage. And that will be the second cartilage of the larynx known as the cricoid cartilage, right? Cricoid cartilage. And if you continue to run down below the cricoid, that will be the trachea. That will be all the tracheal rings, yeah, all the cartilages of the trachea. Right, there are some important landmarks that you have to take note. Upper border of the thyroid cartilage correspond with the fourth cervical vertebra, the fourth cervical vertebra. As for the lower border of the cricoid cartilage correspond with the sixth cervical vertebra. All these are very important landmarks, yeah. At the level of the fourth cervical vertebra, that's where the bifurcations of the common carotid into internal and external carotid artery, right? And at the bifurcation is also where we find receptors, interoreceptors for the blood pressure, as well as receptors for chemical, right? The chemoreceptors and baroreceptors at the bifurcations of the common carotid. And at the level of the lower border of the cricoid, which correspond with sixth cervical vertebra, that's where the larynx end and the trachea begins. And behind the larynx will be the pharynx, and that's where the pharynx end and the esophagus begins. All right? So these are all very, very important landmarks that you have to take note. Right? So if we were to actually look at the side view and superimpose some of the skeletal structures, yeah. And first we locate the lower border mandible. Of course, behind will be the angle of mandible. Locate the cricoid cartilage, not cricoid cartilage, the hyoid bone, yeah, the hyoid bone. Then after that, locate the thyroid cartilage, followed by the cricoid cartilage before it becomes the trachea. And take note of the corresponds between the lower border of the cricoid, which is C6, and upper border of the thyroid, that will be C4, because important actually things happen at these two levels, right? That's bifurcations of the common carotid into internal and external, and that's where we find the receptors, interoreceptors. Yeah, all right, good. Okay, this is looking from the front, right? So again, below the body of the mandible, that will be the hanging bone, the hyoid bone. Below that, that will be the thyroid cartilage, okay, the thyroid cartilage, one of the very important cartilage for the larynx. And further below that, that will be the cricoid cartilage, yeah. And please take note of the corresponds vertebra between these two, right? And of course, there are some very important structures related to this larynx and the trachea, yeah, at the lower part of the neck. And of course, the most important glands within the sort of the neck will be the thyroid gland, which we're going to elaborate in the short while, right? Good. Okay, this is looking from the front view, right? Male, female, the side view, male, female. Again, showing the important landmarks within the neck that you have to identify, right? Okay, right. In the past, actually, when we learn about anatomy, if you were to actually open up all the standard anatomy textbook, textbook will actually divide the neck into triangles. To divide into triangles, of course, we need to have some landmark muscles, right? The most important landmark muscles in the neck will be these muscles running. Remember just now I said this part of the skull known as the mastoid process, right? And of course, we can recognize the joint between the clavicle and the sternum. There's one muscle actually runs between the mastoid process and the sternoclavicular joint, and we call this muscle as sternocleidomastoid. Very often students will call this SCM, right? Sternocleidomastoid. Sternocleidomastoid is the key muscles, reference muscles that we divide the neck into. Anything that is behind is known as posterior triangle. This is the posterior triangle. And anything that is in front is known as the anterior triangle. And of course, textbook will further subdivide the triangles into many, many sub-triangles. Don't have to worry about that. You just have to know the big picture. That is good enough, right? So the other thing that you need to take note is the anterior triangle is where structures actually communicate between the neck and the thorax. As for the posterior triangle is where structures communicate between neck, thorax, and the upper limb. Right, please take note, neck is a conduit, is a conduit, or there's a lot of communication between structures in the neck, thorax, and the upper limb. Right? So just take note of this triangle. Okay, first we can actually look at the sort of general arrangements of the structures within the neck, right? So remember, neck is an extension of the trunk above the thorax. So they have certain sort of general characteristics. First, of course, there need to be a backbone, which is formed by the vertebra, cervical vertebra for this case. And of course, within the cervical vertebra, actually, there will be a vertebral foramen with a spinal cord, so on and so forth, right? And surrounding this cervical vertebra, there will be a group of muscles. Some of these muscles are located anteriorly. Okay, these are the anterior group muscles, or we call it prevertebral muscles. And there will be a group of muscles surrounded posteriorly. And if you apply the same principles for those muscles in the trunk, those muscles anterior to the vertebra, basically when they contract, they actually sort of flex the spine. So similar principles can be applied here. The muscles actually located in front, when they contract, they actually suffer, flex the cervical vertebrae. And similarly, the muscles located at the back, when they actually contract, they actually extend, right? So these general principles you can apply, right? In addition to that, the neck here has a group of organs also, but of course it's not as much as in the thorax or abdomen. So this is the sets of organs found within the neck, right? There are two tubes, and these two tubes actually belong to two different functional systems. The one in front actually is for respiratory system, larynx and the trachea, and the tube behind actually is pharynx and esophagus. That will be the digestive system. Right, surrounding the two tubes, there's a very important sort of endocrine organs known as the thyroid gland. You have learned that in semester 1 when you did the endocrine system. And of course, in addition to that, behind that there will be two pairs of parathyroid gland. These are very, very important glands. And you have already seen in other parts of the body, you need to have a very important neurovascular bundle, right? And of course, the main artery within the neck will be the carotid artery. We already actually sort of mentioned just now, the common carotid artery splits into internal and external carotid artery, right? Right, this is found just slightly posterolateral to the viscera of the neck. And then the artery is accompanied by a vein. We call this the jugular vein. There are two jugular veins in the neck. One is found inside, the other one is found superficial to the sternocleidomastoid. Remember the sternocleidomastoid we mentioned just now? Right. This is inside, so we call this internal jugular vein. The one outside is external jugular vein. I'll show you the pictures later. right? Right, and after that, superficial to that, yeah, there'll be some muscles that form the wall, so on and so forth, right? So that will be the general arrangements of the structures within the neck, right? Let's reorientate this one. Supposing if you are doing a dissections, right? So commonly for the neck, dissection is done by a midline cut from the chin all the way down to the suprasternal notch and along the lower border of mandible all the way to the mastoid process. And on the inferior aspect, from the suprasternal notch, we extend laterally, cut along the clavicle until the shoulder joint, right? Then after that, we lift up the skin and then reflect laterally, right? The first thing that we come across when you put a scalpel blade on the patients or on the silent mentor, that would be skin. And underneath the skin, you can see the yellow color. Yeah, that would be the subcutaneous fascia or the superficial fascia underneath the skin, right? So of course, superficial fascia is made up of connective tissue as well as some fat as well, right? And for the neck, it's quite unique. In the superficial fascia, we can find, yeah, there's a muscle known as platysma. This is the skeletal muscles, which quite uniquely migrate down during development from the face towards the neck, right? So this is known as platysma, right? And deeper to that, there will be two muscles that form the wall of the neck, right? The one in front, this is the muscle that we mentioned a few times, sternocleidomastoid, yeah, because it attached between mastoid process to the sternum as well as the clavicle, sternocleidomastoid. And this muscle, you have seen this when you did the upper limbs, yeah? There's a diamond-shaped muscles at the back known as the trapezius. Yes, this is the trapezius. So trapezius, posteriorly, sternocleidomastoid, anteriorly, they will form the wall, yeah, in the neck, right? And then anteriorly, in front of the group of viscera, there's a group of muscles. Yeah, this group of muscles actually are found below the hyoid bone. So they are also known as infrahyoid muscles. Because of the appearance, they are also known as strap muscles. Okay, they are made of 4 muscles, which I'll go through with you later, right? These are found in front of the viscera, in front of the thyroid, in front of the larynx and the trachea, right? And then, of course, posterolaterally, you have the neurovascular bundle, right? Neurovascular bundle, carotid artery, internal jugular vein. And in between, there's a very important nerve. This very, very important nerve. You have already seen when you did the thorax. And this important nerve also go down to abdominal cavity to supply many of the organs, right? Any of you actually want to guess, which nerve is this? Excellent, this is cranial nerve number 10, the vagus nerve, yeah? Vagus nerve is sandwiched between the artery and the vein in the neck. So you must identify vagus nerve and of course the carotid artery and the internal jugular vein later, right? And then after that, we move back a little bit to this group of muscles. Okay, even though we don't require you to actually recognize most of the muscles surrounding the vertebra, there are 2 muscles we want you to actually remember. Very, very important because there's a lot of important relations there. One of them actually, you may have actually briefly come across when you did the thorax or when you did the upper limb, yeah? We call this the scalenus anterior. It will be scalenus. Of course, there's another scalenus behind the medius known as posterior, but don't bother about that. You just have to recognize anterior and medius, right? I'll show you the anterior and medius later on from the front and the side, right? They are very, very important because there are bundles of nerves that exit between these 2 muscles. And one group of nerves actually that exit between these 2 group of muscles, they actually move on to the upper limb. Do you remember which bundle of nerve that moved from the neck down to the upper limb? Excellent, the brachial plexus. Yeah, the brachial plexus basically is sandwiched between the scalenus anterior and the medius, right? And of course, there's one other nerve which is also very important. This nerve actually you have seen when you did the thorax. If you were to trace the nerve down, it goes to the diaphragm. Which nerve was that supplied the diaphragm? Excellent, that is phrenic nerve. Yeah, phrenic nerve you must recognize, and this is the nerve that actually runs in front of the scalenus anterior. I'll show you later. So all these are very important relations that you have to take note. All right? Okay. In addition to that, we also want you to actually sort of roughly understand some of the fascia, deep fascia, important deep fascia within the neck. All these fascia plane are important because infections from the neck may potentially spread down to the thorax via the space between the fascia, right? The first deep fascia that you come across if you were to do dissections, all right, will be this green color. Okay, so generally in the neck, there are 3 groups of deep fascia. Or we call it deep cervical fascia, right? The first one is investing layer. Investing layer of the deep cervical fascia, that is the one in green. Okay, investing layer. Sorry. Okay, and then the second layer, the one in gold color, because they surround around the vertebra, we call it the prevertebral fascia. Okay, so you can see the prevertebral fascia surrounds the muscles surrounding the vertebra. And then the third layer, the one in purple, because they surround around the trachea, we call this the pretracheal layer. So these are the 3 important deep fascia of the neck, or deep cervical fascia. First, investing layer. We call this investing layer because if you can actually see, the green color actually invests the sternocleidomastoid as well as invests the trapezius. So the deep fascia investing layer actually surrounds the neck just underneath the superficial fascia of the neck, right? And then of course we have the prevertebral fascia, surrounds the muscles surrounding the vertebra. And then the pretracheal, the one in purple color. Right, the older textbook actually will actually sort of indicate, these 3 fascia will actually contribute to form one more fascia that surrounds the main neurovascular bundles. This one they call it the carotid sheath. So if you were to do dissections, when you actually reflect the sternocleidomastoid, then you come across the carotid sheath. Carotid sheaths are contributed by these 3 layers: investing layer, prevertebral, as well as pretracheal layer, right? And of course, carotid sheaths will surround the carotid artery, the internal jugular vein, and some of the cranial nerves, including the vagus nerve, right? So this will be the overview of the structures within the neck, right? So if we were to ask you relations, you can actually sort of use this, overview cross sections of the neck to actually describe the relations. We come to that later when we talk about relations of the thyroid gland. All right? So these are very important slides for this particular lecture because this will actually give you an overview of how the structures are arranged and how they are related to one another. Okay? Good. Okay. This is a side view showing the neck, Remember we mentioned the neck is divided into anterior and posterior triangle, right? So if we were to actually sort of remove the skin, superficial fascia, and the deep fascia, right? Of course, the 2 important muscles that form the wall, right? That will be the, what muscle is this? Very good. This is the sternocleidomastoid, attached to the mastoid, clavicle as well as the sternum, right? Sternocleidomastoid. And the one that forms the behind, posterior wall will be the trapezius, right? So bounded between the sternocleidomastoid and trapezius, the one shaded in blue color, that is the posterior triangle. Anything that is behind the sternocleidomastoid is posterior triangle, right? Anything that is in front of sternocleidomastoid, that will be the anterior triangle, right? So of course, if we were to actually sort of remove all this, the anterior triangle is further subdivided into many sub-triangles using other muscles. Like for example, there are a few other smaller key muscles in the neck. One of them actually is very, very important, okay? Before that, we want you to actually come back to this important floating bone here, the hyoid bone, Attaching the hyoid bone, this is a very important muscle known as the digastric muscle. Digastric muscles are quite unique because it has 2 belly and then it has a center tendon that attach to the hyoid bone, right? So it has the anterior belly and the posterior belly. It's quite unique because it derived from two different embryological structures, which my colleague actually will elaborate to you later, right? So this is digastric muscles, and digastric muscles, during my time actually, it was important muscle because we use it to actually subdivide the anterior triangle into many sub-triangle. Like for example, yeah, this one we call it the digastric triangle, right? And between the digastric and sternocleidomastoid, and this is another muscle here which I'll mention the name later. This is known as the carotid triangle, so on and so forth, right? This is for those people who are curious, who you want to actually know more about the sub-triangles or anterior, you go ahead, right? The rest you just appreciate, yeah? Right, so I mentioned this muscle here. This is also another muscle that has two belly. This is known as omohyoid. Right, this is, it sort of has attachments at the back to the scapula, right? Then it runs forward, and then it has a sling of tendon that attach to the sternoclavicular joint. And then the upper belly will actually sort of go over to actually attach to the lower part of the hyoid bone. That's why it's known as omohyoid. Right? Remember we mentioned the strap muscles. Strap muscles, yeah, they are made up of four. Omohyoid is one of them. Omohyoid is one of them, right? Okay. So strap muscles is also known as infrahyoid because it's below the hyoid bone. In fact, digastric is also known as muscles above the hyoid, suprahyoid muscles, right? So just take note some of these important landmark or key muscles. First, of course, will be the sternocleidomastoid, right? And just below the mandible, digastric muscle, right? And of course, omohyoid, which is part of the strap muscles that we're going to elaborate in a short while, all right? So this will be the basis for the divisions of the triangles within the neck, sternocleidomastoid, so on and so forth. Okay, right. Okay, now we are going a little bit deeper, right? What muscles have we removed? Right, we have actually cut the sternocleidomastoid. So right now we are going deep to the sternocleidomastoid. What do you call the neurovascular bundle? Right, the carotid sheath and contents, right? Okay, can you still see the carotid sheath? We can't, yeah? Carotid sheath has been removed. So we are looking at the contents of the carotid sheath. What is the artery? Yes, the common carotid and the bifurcation into internal and external carotid artery, right? This is a bifurcation. Where does the common carotid artery bifurcate? At which level? Any landmark? Right, at the upper border of the thyroid cartilage. Which cervicovertebral level was that? Yes, C4, at the level of C4, right? Okay, and accompanying the carotid arteries will be the internal jugular vein, right? And what is the main nerve that sandwich in between? Very good, the vagus nerve, right? So if we were to actually cut partly the internal jugular vein, you can see the sandwich nerve here. That will be cranial nerve number 10, the vagus nerve, right? So that will be the carotid sheath and contents. Of course, the sheath has been removed to show us the content. Carotid artery, and branches. Of course, later on we go through the branches. And of course, the internal jugular vein, sandwich in between will be the vagus nerve, right? And from this diagram, we could also see, can you still see some of the strap muscles? Right, very good. This is strap muscles, superficial, it runs between the sternum is here, and the hyoid bone, this is hyoid bone. What do you call this? Very good, sternohyoid muscles. Can you still see the omohyoid? Right, omohyoid has been cut, yes. Then we can see the two deep muscles of the strap. Okay, this is one muscle running from the sternum to the thyroid cartilage. This is the thyroid cartilage. How would you call this? Sternothyroid, very good, sternothyroid. And from thyroid cartilage up to the hyoid bone, excellent, thyrohyoid muscles. So together with omohyoid, they make up the strap muscles, very good, right? So what else can you see from this diagram? This is just after we remove the sternocleidomastoid, then we see almost everything, right? Can you see the thyroid gland? We can't yet because part of the strap muscles are still there. So we can't really see the thyroid gland yet until we remove other parts of the strap muscles. right? So what other thing can you see? Can you see a bundle of nerve? Can you see this bundle of nerve? Right. If you see carefully, this bundle of nerve going towards the upper limb. What group of nerve is this? Excellent. This is brachial plexus. Can you see the light now? These are the brachial plexus that coming from the neck go over to the upper limb to supply them, right? Okay, this is brachial plexus. Right, do you remember brachial plexus are sandwiched between which two muscles? Very good. This is scalenus anterior muscle and scalenus medius muscle. Sandwiched between these two muscles will be the brachial plexus. Very good. Right. One more. Can you see the nerve that cross in front of the scalenus anterior? And this nerve actually has been seen when you did the thorax. And if you trace it down, it goes down to the diaphragm. What nerve is that? Very good. That was the phrenic nerve. The phrenic nerve. Do you remember the root value of phrenic nerve? Excellent. C3, C4, C5. And why does the phrenic nerve descends down to the thorax to supply the diaphragm? Very good, because of embryology. During development, actually, the diaphragm actually descends down from the neck, to the final destination between the thorax and the abdomen, right? So that was phrenic nerve. So these are the few things that you must recognize, tomorrow when you do the practical. So when we remove the sternocleidomastoid, we should be able to recognize the carotid sheath and contents. Of course, when we remove the sheath, we are looking at the contents, carotid artery, internal jugular vein, sandwiched between with the vagus nerve, right? And of course, we can recognize the phrenic nerve that runs in front of the scalenus anterior. If you look hard enough, you can see no need hard enough. Actually, it's so clear, you'll be staring at you. The brachial plexus, sandwiched between the anterior, scalenus anterior, and medius. And of course, try to recognize as many strap muscles as possible. All right? Good. Okay, let's move on. Right, basically this is a schematic drawing showing us the arteries and the main veins in the head and neck region, right? So veins, we don't have to worry too much. When we go to cranial cavity, we'll be looking at some of the veins inside the cranial cavity. So today, basically, we have just stressed to you, two veins. One is external jugular, the other one will be internal jugular, right? And of course, usually veins will run together with the artery. So if there's one artery that runs with the vertebral artery, how would you call it? Vertebral vein. This is a vertebral vein, right, that runs together with the vertebral artery, right? Other than that, basically, they are just corresponding veins, right? So let's move on to these two other pictures, right? This one actually shows us the whole of the vasculature of the head and neck, right? So of course, this one actually looking from the right side, the common carotid splits at the level of upper border of the thyroid cartilage into internal and external carotid artery. Then remember, we said internal carotid artery doesn't have any branches in the neck. All the branches that we see basically come from the external carotid artery. Internal carotid artery will run into the cranial cavity. Okay, let's look into this. Remove the external carotid artery and branches, right? So this is the internal carotid artery that runs and enters through a foramen into the cranial cavity. This is the cranial cavity. Remember, we were saying in addition to internal carotid artery, there's another artery. Yes, that will be the vertebral artery we mentioned briefly just now, right? It's a deep branch of the subclavian that runs towards the cervical vertebra, enters into the foramen transversorium, and finally, it enters into the cranial cavity together with the internal carotid artery. They form a circle to supply the brain and structures within the cranial cavity. This one will actually sort of go into more detail when we do the cranial cavity on week 3, all right? Okay, so let's go back to the external carotid artery and branches. Okay, let's move on. Right, so we want to introduce you to some branches of the external carotid artery. So we can actually use some sort of general sort of understanding, big picture. Right, so okay, ignore the internal carotid. This one, internal carotid, we ignore for a time being because we only stress that in the cranial cavity. Right, so the external carotid artery is this one. So external carotid artery started at the bifurcation of common carotid. It runs upwards into a gland behind the mandible. What gland is this? Right, it runs into the parotid gland. And in the parotid gland, it splits into two terminal branches. One of them runs over towards the scalp. We call this the superficial temporal. Yeah, this part here of the head, we call it the temple, the temporal fossa. So the artery will be temporal, yeah, superficial, because it's superficial temporal artery. And the other terminal branch are the final branches, yeah, final branches of external carotid artery that was given rise within the parotid gland, right? This branch here runs into this bone. What bone is this? Yeah, this is the upper jaw. This is maxilla. So we call this the maxillary artery. Very important artery that will supply many structures in the head, yeah, including the part of the orbit, nasal cavities, and of course the maxilla and the teeth, right? The palate also, right? And one of the branch we have already mentioned a few times, it goes down to supply the thyroid gland. What branch is that? Yes, superior thyroid artery. Superior thyroid artery. One of the branch of external carotid artery, if you look carefully, it moves over to supply the face. How would you call this branch? Yes, this is facial artery. Right, facial artery. Okay, one deep branch, okay, which is partially cut over here, that will go deep to supply the tongue. How would you call the artery that supplies the tongue? Very good, artery. Artery. Yeah, these are some of that we can see. Superficial temporal, quite easy to see when we do next week, face and scalp. Maxillary artery, when we go actually explore deep to the mandible or maxilla, we can see the maxillary artery, very important branch. Facial artery is very clear when we do the face and scalp next week. Superior thyroid, we're supposed to explore today, yeah. And then lingual artery is a little bit deep. If we don't see, not to worry too much, right? And there are some other smaller, not smaller arteries. There are some other arteries that run slightly deeper. One of them goes towards the back, towards the occipital bone. How would you call it? Very good. This one we call it the occipital artery. The occipital artery. And one of the branch, okay, one of the branch, I'll erase this one. Okay, one of the branch runs behind the ear. Can you see this branch runs behind the ear? Very good. We call this a posterior auricular artery, behind the ear. This is the external ear, auricle. So posterior auricular artery. And there's one deep branch that go up to supply the pharynx. We call it the ascending pharyngeal. The one a little bit deep. I'm not going to show you. Yeah, a bit deep. Right. So these are the major branches of the external carotid. So actually, it's not difficult. Don't have to actually memorize them. You could actually work it out. Yeah. The branch that supply the thyroid, we call it thyroid artery. The branch that supply the face, facial artery. Branch that supply the tongue, lingual. Branch that supply the maxilla, maxillary artery. Branch that runs in the temple, temporal artery. Branch that goes to the occipital bone, occipital artery. Branch that runs behind the ear, posterior auricular. Right? These are branches of the external carotid artery. Very easy, right? Yeah. Okay. But one thing that we want to actually stress to you will be, okay, the two superficial temporal artery runs towards the scalp. Do you think that they will meet? Right? Why not? So when they meet, when an artery meets another artery, what do you call it? Anastomosis. And what does that allow? Collateral circulation. Collateral circulations are very important for the head and neck region because they have very rich blood supply, right? And remember the thyroid, yeah, are being supplied by superior and right and left superior thyroid arteries. Do they meet? Of course. And of course, another collateral circulations. Thyroid is also supplied by inferior thyroid artery. Do the branches of inferior thyroid and superior thyroid meet? Of course they meet. How about the facial artery? Do they meet? Right, they meet at the medial angle of the eyes. So all these will give rise to collateral circulation, anastomosis and collateral circulation. All right? Okay, that will be the concept we want to stress to you. Lots of anastomosis and it allows collateral circulation. Right? Okay, let's move on. Okay, same view, side view, but different sort of depth, right? Of course, we have removed the sternocleidomastoid, we have removed the scalenus anterior and medius, right? The strap muscle is still left intact. Now, actually, you can see the omohyoid is restored. Yeah, omohyoid is restored, right? What do you observe? Something that is different from the previous slide. Yes, there's a loop of nerve. This loop of nerve are quite unique. It's part of the branch of the cervical plexus. If you see carefully, this loop of nerve will give rise to smaller branches to supply the muscles of the strap muscles. And this loop of nerve is known as ansa cervicalis. Right? So of course details not required. If you were to look at this diagram, superior root, inferior root, all this, if you want to know detail, these are all the details. But so basically ansa cervicalis is a loop of nerve, part of the cervical plexus. They will supply the strap muscles. Generally they are found, okay, it varies between textbooks. Some say superficial to carotid sheath, some say it's on the carotid sheath, some say it's deep inside the carotid sheath. Don't worry about the variations between authors. So you just have to know that this loop of nerve are found around the carotid sheath. That is good enough, all right? Okay, and they will supply the strap muscles. Okay, let's move on to actually sort of go slightly deeper. Look at the viscera in the neck, right? So if you are looking from the front, this is of course the overview that we have covered just now. The viscera of the neck basically is made up of glands, some endocrine glands, two very important tubes. The respiratory tube is in front, larynx continue as trachea, behind will be the digestive tube, pharynx continue down as the esophagus, right? And of course, we want you to actually take note of some of the landmarks, right? Of course, you can recognize, you can palpate the hyoid bone. We could actually palpate the thyroid cartilage, right? And below that will be the cricoid cartilage. And further down will be the trachea and its sort of a trachea cartilaginous rings, right? And surrounding this lower part of the larynx and the upper part of the trachea will be very important organs known as the thyroid gland. Okay, this is the anterior view of the thyroid gland and the posterior view of the thyroid gland. Okay, so let's we have done the endocrine part of the thyroid gland as well as the histology of thyroid gland, and you need to recognize them under the light microscope. All right, so if we were to actually look at the sort of a lower neck, remove all the muscles and the neurovascular bundles, right? Located in front of the two tubes will be the thyroid gland. Basically, thyroid gland is described as bilobe connected by an isthmus. This is the isthmus that connect the two lobes of the thyroid gland. So the lobe can be described as, some book will describe as pyramidal shape, some book will describe as conical in shape, some book will describe as a pear in shape or whatever, right? So the apex of the pyramid is of course facing towards the larynx, and then the base is facing towards the trachea, right? So this is anterior view, right? Bilobe and connected by an isthmus. The isthmus actually runs below the cricoid cartilage. Usually most textbooks will say it runs between the second to the fourth tracheal rings. Okay. So therefore, sometimes if there's an upper respiratory sort of obstruction, we could actually perform some procedure to actually open up the airway. Of course, we have to actually be mindful of the isthmus of the thyroid gland so that not to injure, because thyroid gland being an endocrine gland is very, very vascular. So injury of those endocrine gland usually will be very, very bloody. All right. So if we were to actually look from the posterior view of the thyroid gland, this is again the lobes, the two lobes of the thyroid glands. And the other thing I forgot to actually mention, being a gland, usually gland is sort of lined by capsule. Capsule are basically the dense connective tissue. And the capsule will send in a lot of connective tissue to form septa. And because of all these septa, glands usually appear lobulated. This is quite standard for all the glands. The glands that we see, whether they are exocrine gland or endocrine gland, because of a lot of connective tissue septa, they'll form lobules. So on the surface, they appear lobulated, right? So this is from the posterior view. Let's orientate. So of course, the posterior tube will be, upper part will be the pharynx, and it will continue downwards as esophagus. Of course, for this case, esophagus has been partially cut to show the posterior surface of the trachea, right? And the other thing that we need to take note, posterior to the thyroid gland will be two nodules, two pairs of nodules. These are the parathyroid glands. Parathyroid glands, right? So my colleague actually will sort of lecture to you on the developments of the thyroid and the parathyroid. They are very, very important, Okay, please take note of that and correlate, right? So how do we actually suffer? So this is basically the appearance of the thyroid gland and the immediate relations, yeah, to the two tubes, right? Immediate relations to the two tubes, right? Okay, before we move on, I would like to introduce you to one of the muscles in the larynx, yeah, one of the muscles in the larynx. Okay, remember the cartilage of the larynx? This will be the thyroid cartilage, and over here will be the cricoid cartilage. How would you call a muscle that runs between the thyroid and the cricoid? Good try. Okay, some of you call it thyrocricoid. The actual name is cricothyroid muscle. Cricothyroid muscles. These are very important muscles in the larynx, which we will lecture to you again on the 6 weeks. Yeah, it's part of the intrinsic muscles of the larynx. And these muscles are very important for screaming, yeah, because it will tense the vocal cord that give rise to sound, right? So you just take note for the time being. Yeah, it is deep to the thyroid gland, and it runs between the thyroid and the cricoid cartilage, and they are known as cricothyroid muscles, cricothyroid. But during exam, sometimes you have mental block. Instead of putting cricothyroid, you put thyrocricoid. Okay, we give you some sympathetic marks, yeah, sympathetic marks, right? Because you're applying the right principle. Okay, let's move on. Okay, let's move on to actually look at the sort of blood supply of the thyroid gland. Yeah, right. This is again looking from the front. This one looking from the back. Okay, generally, thyroid gland basically is supplied by two sets of blood vessels. One set of blood vessels actually coming from the top, so we call this the superior thyroid artery. And basically, superior thyroid artery comes from a branch of the external carotid, right? Remember, the common carotid bifurcates into external and internal. Okay, most of the structure in the head and neck supplied by branches of the external carotid artery. Because the internal carotid artery doesn't give rise to any branches in the neck until it goes into the cranial cavity, because the main supply of the internal carotid artery and branches are structures within the cranial cavity and the orbit. And when we move on next week to face and scalp, part of the branch of internal carotid artery will supply the forehead, right? But for the time being, in the neck, basically, they are all supplied by branches of the external carotid artery, including superior thyroid artery, all right, from the external carotid. And there's another branch. Yeah, this one actually coming from the subclavian, yeah, because they come from below, so we call this the inferior thyroid artery. Okay, superior thyroid artery, inferior thyroid artery. And remember, when an artery meets another artery, what do you call that? Anastomosis. Very good, anastomosis. And what does anastomosis allow? Yes, collateral circulation. Very important. Collateral circulation is a very important concept, yeah, when there's a blockage of blood vessels. So because of the anastomosis, it allows sort of different route of the blood coming from the alternative blood vessels to supply the area that has been occluded, right? So this is very important. So around the thyroid gland, there's a lot of anastomosis between the right and the left superior thyroid, between branches of the superior thyroid and branches of the inferior thyroid. And of course, between the two branches of the inferior thyroid also, left and right inferior thyroid. So lots of anastomosis around the thyroid gland, all right? Okay, so please take note of, in the head and neck region, lots of anastomosis that allow collateral circulation. Right, and of course, the venous drainage, the veins will be the corresponding veins, superior thyroid vein that drains to the internal jugular. And of course, we have the inferior thyroid vein, which usually drains to either the subclavian or sometimes the brachiocephalic. Remember, venous drainage, a lot of variations, right? Okay? Right. Okay, one other thing that we like to actually stress to you, very, very important, will be the nerve, important nerve that is related very close to the blood vessels, right? The superior thyroid artery is very close to the nerve that supply. Remember the muscles? Remember this muscle? Yes, this is a cricothyroid. Yeah, the cricothyroid is supplied by a nerve known as the external laryngeal. External laryngeal nerve actually is a branch of the vagus nerve. Yeah, it's a branch of vagus nerve. Yeah, so please take note, superior thyroid artery is very close to external laryngeal. So during operations of the thyroid gland, sometimes we need to actually ligate the superior thyroid artery, and the surgeons have to be very mindful, very careful of the external laryngeal nerve, because if they were to sever this external laryngeal nerve, then you have difficulty of screaming. All right, okay. And the other thing that you need to take note will be the inferior thyroid artery, which is also close to another nerve that supplies the larynx. Right, it is very close to this nerve that supplies the larynx. You have seen this nerve when you did the thorax on the left side. Yeah, it begins at the arch of aorta. Right, the recurrent laryngeal. Sorry, my handwriting is a bit ugly. So inferior thyroid artery is very close to recurrent laryngeal nerve. So during again ligations of this artery, the surgeons have to be very careful not to ligate together with the nerve. Otherwise, all the muscles will be knocked out. All right. So if we were to actually look from the posterior angle, posterior aspect, this is the superior thyroid artery. This is the inferior thyroid artery. Okay, this is the recurrent laryngeal nerve that we were talking about. Can you see the proximity between the recurrent laryngeal and inferior thyroid artery? Very, very close, right? And of course, it is not shown here, Superior thyroid artery is very close to which nerve? Yes, the external laryngeal nerve. So these are all important relations that you need to take note clinically, all right? Superior thyroid close to external laryngeal, inferior thyroid close to recurrent laryngeal nerves, all right? Good. Okay, right, okay, this is just to show you the superior thyroid artery basically arises from the external carotid artery. Right, how about this one? Right, this one basically showing you the inferior thyroid artery arises from subclavian, right? And it is very close to the recurrent laryngeal nerve, recurrent laryngeal nerve. This one, this is a recurrent laryngeal nerve. All right, and of course superior thyroid is very close to external laryngeal nerve, all right? So if we were to ask you to describe relations, okay? So basically this is looking from different deafness, the depth of the neck dissections, right? So, right, you can see that the thyroid gland is deep to the, what group of muscles is this? Right, these are the strap muscles. So then after that you see the thyroid gland, right? So if we were to actually remove the thyroid gland, what are the structures deep to the thyroid gland? That would be the viscera, other viscera of the neck. Larynx, trachea, and behind will be pharynx, esophagus, right? How else do you want to describe the relations? Of course, carotid sheath and contents, So again, if you were to actually look from here, a little bit difficult to describe. Easiest way to describe the relations of the thyroid, again, go back to the cross sections of the neck. Go back to the cross sections of the neck. Okay, let's locate our thyroid gland. Yes, these are the two lobes of the thyroid gland. And of course, this will be the isthmus of the thyroid gland. There are many ways to actually describe the relations of the thyroid gland. But personally, I would like to actually describe the relations of the lobe and then describe the relations of the isthmus separately. Okay? If I were to describe the relations, the lobe, related deep to the lobe will be the two tubes. The trachea, above the trachea will be the larynx. Please remember, always remember to mention this too, because the thyroid gland is related to these two, larynx continue as a trachea. And behind will be pharynx and esophagus, right? And remember just now we mentioned one of the nerve that supplies the larynx, the recurrent laryngeal nerve. The recurrent laryngeal nerve runs between the two tubes, So these are important deep relations of the thyroid gland, deep relations. And superficial to the thyroid glands, of course, we have this group of muscles, the strap muscles, right? And posterior relations of the thyroid gland will be this carotid sheath and contents. Elaborate on the contents. Carotid artery and bifurcation, internal jugular vein, and of course, sandwiched in between will be the vagus nerve. All right? Okay? Right. So that will be the relations of the lobe of the thyroid. So if we were to describe the relations of the isthmus, slightly similar. Deep to that will be the trachea and the larynx. Superficial to that will be the strap muscles. This is how best to actually describe the relations of the thyroid gland. Okay, right? So you can use the same principles to describe relations for the structures within the neck, best actually to do a cross sections. All right, okay. Okay, come to your favorite part. Yeah, that will be the histology of the thyroid gland. Right, thyroid gland is quite easy, yeah, because it's very characterized. It has certain very, very specific characteristics. Basically, yeah, if we were to actually look at the low magnification of thyroid gland, basically the whole gland actually is made up of all this, which we call it the thyroid follicles. And on the surface of thyroid follicles, of course, we have the thyroid epithelial cells. And those are the cells that actually will secrete the hormones. Thyroid gland secrete what hormones? Excellent lah, thyroid hormones law, right? And then if we were to ask you, okay, thyroid glands is very easy to identify because there's no other parts of the body that look like that. And we expect you to be able to identify, yeah? Higher magnification, yeah? You can see the epithelial cells, which we call it the follicular, thyroid follicular cells, right? And if we were to ask you parathyroid, basically it's a lumps of cells. So if we were to just remove out the thyroid just to ask you like that, it's a little bit unfair because there are few organs in the bodies look something like that. You know, if you have aggregations of lymphocytes, actually you look a little bit like that also. So if we want to ask you parathyroid gland, we'll show you a little bit of the thyroid glands. So you can see the follicles, and then next to that, that will be the parathyroid glands, right? And of course, parathyroid gland, you know that it's located behind the thyroid gland. And basically the blood supply, the blood vessels that supply the thyroid will supply the parathyroid also, right? Okay, take note of that. And of course, what is the function of parathyroid gland? Right, secrete hormones. What hormones? Parathyroid hormones. Do you know the functions of each of these hormones? The hormones in the thyroid? Right, basal metabolic rate. How about the parathyroid? Right, calcium metabolism. Very, very important. Both of these glands are extremely important. And we expect you to know them, be able to recognize them under the light microscope, right? And then the final slide, final two slides will be a little bit on the lymph nodes in the neck, right? So you have done this is the final regions of the body that we need to actually learn. So you have come across group of lymph nodes in the body, right? There's a group of lymph nodes, yeah, between the thorax and the upper limb in the axilla. Yeah, we call it axillary lymph nodes. And there's a group of lymph nodes between the anterior abdominal wall and the thigh. Yeah, we call this inguinal lymph nodes. Okay, there's another group of lymph nodes between the neck and the head. It is situated at the junctions between the neck and the head, right? So this one we call it the cervical lymph nodes. Yeah, the cervical lymph nodes. Of course, cervical lymph nodes is further subdivided into subgroup. Right, this one underneath the chin, we call this submental. This one underneath the mandible, very good, submandibular. This one is around the ear, we call it the auricular, or sometimes slightly behind, we call this the mastoid also can, right? And we can also call, is there any gland over here? Right, parotid gland. You can also call it the parotid lymph nodes. And there's a group of lymph nodes found behind, near the occipital bone, right? The occipital lymph nodes, right? So this group of lymph nodes is a ring of lymph nodes, cervical ring of lymph nodes, at the junctions between the neck and the head. Submental, submandibular, parotid, mastoid, or we can call it auricular and occipital, right? So they will receive lymphatics from the head and the scalp, as well as, from the upper part of the neck. Then after that, they will drain to a very important lymph nodes group that surrounds the internal jugular vein. And this group of lymph nodes that surrounds the internal jugular vein is known as the deep cervical nodes. Deep cervical lymph nodes. Yeah? There are lymph nodes found deep inside the neck, around the internal jugular vein. Right? Around the internal jugular vein. And finally, from deep cervical lymph nodes, they will drain on the left side to thoracic duct. Yeah, this is the left side to the thoracic duct, and on the right side, they will drain to the right lymphatic trunk. Some textbooks will call this right lymphatic duct. They are the same, right? Remember, yeah, most part of the body will drain eventually to the thoracic duct. Right? The right side of the neck, yeah, head and neck, as well as the right upper limb, they will, and the upper part of the chest will drain to the right lymphatic trunk. Okay, right. So take note, these are the lymph nodes that will receive lymphatic drainage from the head and neck region, right? And of course, we expect you to be able to recognize lymph nodes under light microscope. It has capsule, of course, then it has a cortex. Then the lighter color here will be the medulla, and in the cortex actually, yeah, you can see, yeah, aggregations of the lymphocytes at different maturations. Yeah, we call it the lymphatic nodules. So we expect you to be able to recognize lymph nodes under light microscope and know what type of lymphocytes are found in different parts of the lymphatic nodules, the germinal center, so on and so forth. Right? So with this, we have concluded today's lecture on the neck. Hopefully you have learned a little bit before we move on to other parts. Okay, I'll give you a short pre-lab talk tomorrow before you go on to the lab, right? So, okay, with this, I hope I've covered all this. Yeah, that is good enough for your tutorials, right? Thank you very much for your cooperation, and I hope you continue to enjoy head and neck lectures. Yeah, happy learning. Thank you very much.